Very good morning to everyone who have joined us from South Africa. I welcome all the parents and caregiver of the children with cerebral palsy to my webinar, Cerebral Palsy, Why Fit In When You Can Stand Out. So I have given this subtitle intentionally about why fit in when you can stand out, because it is not only about the children who have the diagnosis of cerebral palsy, but it is also for their parents who dedicate their time, efforts, and love to make their child as functionally independent as he or she can. So there are many people there who have not let cerebral palsy define how their life will be. And by the end of this webinar, I want all the parents to know that cerebral palsy is just a diagnosis and it is not the end of the world. So let's get started. The objective for the today's webinar are introduction to cerebral palsy, causes of the cerebral palsy, types of cerebral palsy, the early markers, medical and surgical management, rehabilitation, and why is it important in cerebral palsy, then parental advice to the therapist's insights, and recent advances such as stem cell therapy. Now I will start with introduction of the cerebral palsy. So, cerebral palsy, this term, was first described by an English surgeon named as William John Little in 1860. It was previously known as cerebral paralysis. So, cerebral is your brain and palsy is injury to the brain. So, any injury or damage to the brain or cerebrum was known as cerebral palsy. Hence, the definition of cerebral palsy is brain lesion, which is non progressive, occurring at birth, in early childhood, or even before birth, and which causes abnormality in the movement and postural tone. So here we have to focus on two things, that the brain damage or brain lesion is non-progressive. So it is not going to increase, neither it is going to reduce. It is permanent. The damage which has happened at birth, in early childhood, or even before birth is permanent. However, the symptoms or abnormality in movement and posture may vary depending upon the severity of damage, the age of the child, and how early the child is treated. So now let's see what causes CP. So the causes of CP can be divided into before birth, during birth, and after birth, as we saw in the definition. So what are the causes which can cause cerebral palsy in children even before the birth of the baby? So they are related with the maternal health. If mother is having gestational diabetes or thyroid or hypertension and it goes without detection or undetected, or if mother catches any infection such as rubella or cytomegalovirus which is not caught early, it may hamper with the development of the baby's brain when the baby is in the womb. As well as congenital abnormalities of brain can happen when the baby does not get sufficient nutrition. So folic acid supplements, calcium supplements, all are very important for the healthy conception. And during birth, what are the causes that can go wrong during birth? So when the fetal size is too large, that the baby is unable to pass through the birth canal, or if there is problem with the cord around the neck of the baby, or if the baby gets stuck while coming out during the delivery and assistive device needs to be used, in that cases baby may starve of oxygen. So because of the oxygen deficiency, brain has damage and that leads to cerebral palsy. The causes after birth can be described as any infection to the brain, such as meningitis, encephalitis, or if baby has any severe jaundice, which leads to bilirubin going to the brain and causes damage to the small brain. Or if there are any traumas or injury to the bird due to the use of assistive device, that may also lead to cerebral palsy. In some cases, we have noticed that even after no significant birth history or no significant postnatal history, some children may present with cerebral palsy by the age of 1 year. In those cases, some unknown factors such as genetic factors or chromosomal factors may be responsible for the cerebral palsy diagnosis, as well as seizure disorders secondary to any infections or trauma or any injury during birth may also lead to damage to the brain, and that may in future present as cerebral palsy. So this is about the causes. Now let's see what are the types of cerebral palsy. So types can be broadly divided into depending upon the area of brain which is involved and the symptoms in which body part is included, that can be described as types of cerebral palsy. So, for example, the area of brain which is involved, according to that, we can describe cerebral palsy into four conditions, that is spasticity, dyskinesia, ataxia, and mixed. So, what is spasticity? When the brain damage is happened in the cerebral cortex, that's when child will present with the abnormal tone or stiff muscles, that is called as spasticity. Whereas when the basal ganglia is involved, child may have uncontrolled movements, abnormal movement patterns, that is called as dyskinesia. When the small brain or cerebellum is affected, child may present with poor balance and coordination, which is known as ataxia. And when child is showing symptoms or combination of two or more types of following diseases, it is called as mixed CP. In mixed CP, multiple areas of the brains are involved. So let's see what is spastic CP now. In spastic CP, there is abnormal increase in the muscle tone. The muscles are always tensed and contracted. So child will present with stiff, jerky or awkward movements. Limbs of the child are usually underdeveloped because of the constantly contracted muscles. The deep tendon reflexes are increased. Spasticity is the most common type of cerebral palsy and can be seen in 70 to 80% of all the affected cases. Now, as you see in this first picture, you can see the child has crossed the legs like scissors. This is because of the abnormal increase in the muscle tone. Whereas in the second picture, as we can see, one side of the body is normal, whereas one side of the body is affected. In the affected side, because of the stiff muscles or increased muscle tone, the arm is bent, the hand is floppy, whereas the leg also is bent and child is standing on the toes of the affected leg. So, how the cerebral palsy of spastic type presents? Let's see. In this video, the child is having spasticity in the lower legs. If you can see, there is scissoring pattern which is present. Child has difficulty in putting the steps normally because of the stiff muscles, contracted muscles. Also, there is abnormal arching of the back. Now, moving on to another type of cerebral palsy, that is dyskinetic cerebral palsy. When basal ganglia is affected, we can say that the child have dyskinetic cerebral palsy. In this type, it is characterized by fluctuating muscle tone, that sometimes child may look floppy and on the other times child may show stiff muscles. It also involves abnormal involuntary movements. Usually the involuntary movements or stiffness in the muscles or fluctuating muscle tone, it disappears when child is sleeping, whereas all the involuntary movements or stiffness increases when the child is stressed. It may be because of the hunger or when the child is crying. At that time, or suddenly the tone will increase. The dystonia or fluctuating muscle tone also interferes with speaking, feeding, reaching, grabbing, and all the other fine motor skills. This type of CP is seen in around 20% of the affected cases. So let's see how it presents in the children. So if we see in this child, as the child is under stress or crying, there is abnormal increase in the muscle tone. The child is showing abnormal arching of the back. The child is having hands are bent. The backward thrusting or extensor thrust is very common in children with dyskinetic CP. It is also called as dystonia. Now, let's talk about ataxic CP. Ataxic CP, the hallmark of ataxia is poor balance and lack of coordination. So, child may tend to walk or sit with wide base. Depth perception of child is usually affected, which will lead to tendency to fall and stumble. Child will have inability to walk in a straight line. Ataxic CP is the least common type of cerebral palsy and can be seen in 5 to 10% of all the cases. So, ataxic cerebral palsy presents something like this. So, if you can see, the child is trying to give high five, but instead of giving the high five, either he is passing the hand or he is under recruiting the muscles. because of the incoordination. He is not able to do it in a coordinated manner or rhythmic manner. Also, if you can notice, child is sitting with the wide base of support, because in narrow base he will not be able to maintain his balance. That's why the legs are wide apart. He is preferring the W sitting position. When asked to walk or walk on the knees, the child is walking with the wide base, and there is also a tendency of falling or stumbling. Okay. So, when the child is exhibiting features of two or more types of CP together because of the involvement of the multiple areas of brain, it is called as mixed CP. So, child may present with ataxia along with dystonia, or child may have spasticity with dyskinetic features. In that case, we will call it as mixed CP. So this is about the pathological classification. Now, what is topographical classification? Topographical classification is usually used in spastic children, children with spasticity. So what happens in topographical classification is, it is classified on the basis of which part of the body is having spasticity or abnormal tone. So in the below pictures, in these pictures, the blue area is normal and the yellow or orange area is the affected area. So as we see in the first picture, only one hand is affected. So when only one hand or one leg or only one limb is affected, it is called as monoplegia. Whereas when the half of the body is affected, it is known as hemiplegia. When only lower body is affected, it is known as diplegia. And when whole body along with all four legs, trunk and back is affected, it is known as quadriplegia. So usually when the spastic child comes to us, we diagnose him based on the spasticity, that is motor cortex involvement plus which part of the body is involved. So going back, when we see video of this child is showing involvement only of her lower limbs. There is no involvement of the hands or upper body. So we will call her as a spastic diplegic child, whereas this is dystonic quadriplegic child, because all the limbs as well as trunk and neck is involved. Okay. I hope everyone is clear with the types and causes of cerebral palsy. Now moving forward, what are the early markers of cerebral palsy? So what is early markers? Early markers are the red flags which parents or caregivers notice in the early stages of baby's development. Early markers are important because they tell us about something is wrong about the baby or something is not happening normally. So, what are those early markers which parents usually notice in the cases of CP? First is floppy or stiff posture. So, the posture may either be floppy. So, child, when you hang child upside down in the U, there will be no or little movement with the head drop. This is abnormal after 4 or 5 months of age, because after 4 to 5 months child should able to hold the neck or extend the neck. Whereas in stiff posture, child may present as a stiff as board, or child may have abnormal arching of the back or twisting of the legs. So here if you see in the picture, the mother is trying to put a diaper on, but because of the abnormal or stiff posture she has difficulty in doing that. Also, if the child have excessive lethargy, that child is not active at all, sleeping more than usual, or child is irritable all the time when he is awake, have high pitched cry, inconsolable cry, then that also can be a red flag for cerebral palsy. Then poor head control above 4 or 5 months of age is also a hallmark of CP. Also, feeding difficulties associated with weak suck, tongue thrust, tonic bite may also tell us about that something is wrong in the child. And the most common early marker or most common red flag which we see is delayed developmental milestones. So this is the cause when most of the parents notice that my child is not doing some or other thing, and they take the child to developmental physician or pediatrician. So usually child should hold the head by 4 months of age, and child should be able to sit independently by 6 to 7 months, and child will be able to crawl by 9 to 10 months and walk by 12 or plus months. But in children with cerebral palsy, they may have difficulty in holding head by 6 or 7 months of age. They may show difficulty in sitting and walking even after 1 year of age. So that is the time when parents take the child to pediatrician to rule out why the child is having developmental delay and then get diagnosed with cerebral palsy. So this is all about early markers. And why is it important to know the early markers? Because early the child is diagnosed, intervention will start early, and the soon the intervention will start, the child will have more potential to be functionally independent. Now let's see what are the medical and surgical options that are used in cerebral palsy. So we'll start with the medications. So as we said in the definition, the damage that has happened to the brain is non-progressive and permanent. So the damage is already occurred and it cannot be changed now. So why the medications are important, or why medications are given? The medications are used for the symptomatic relief or symptomatic management. They are not going to affect the area in the brain that is damaged. So medications such as anticholinergics, antispastics can be given to relax the muscles, to control the abnormal body movements or involuntary body movements. Anticonvulsants are used if the baby is having fits or seizures. Sometimes because of the deformities, contractures, or stretch pains, baby may feel pain. In that case, anti-inflammatories or pain relief medication can be given. As well as in cerebral palsy, constipation is the constant complaint of most of the parents. Constipation occurs because of the stiffness of the tummy muscles. Because of that, baby has difficulty in passing the stools. In that cases, stool softeners can be used. Now let's talk about Botox. What is Botox? So botulinum A toxin or Botox, it is a substance made by bacteria. So Botox is usually used to weaken the overactive muscles. So basically, Botox is injected into the muscles to relax that muscles. It is a paralytic agent and it acts by blocking the release of neurotransmitter acetylcholine and brings about muscle inhibition. Serial casting will be given after the Botox administration for 1 to 2 weeks to keep the muscle in the lengthened position. And rehabilitation can be started as soon as 24 hours after Botox administration. Effect of the Botox begins after 24 hours of administration and lasts for 2 to 6 months. So what are the benefits and what are the cons of doing Botox treatment now? So benefits of Botox is that it gives us relief from the spasticity. Even if it is temporary, we can use that time frame to strengthen the weak muscles, to improve the alignment of the baby, to improve the posture of the baby, and get maximal functional abilities out without spasticity. And what are the cons of the Botox? Why it is not an ideal method of treatment? Because again, the effects are temporary. The effect of Botox is going to wean off in 2 to 6 months, and after that spasticity will again start to show up. So if the rehabilitation does not occur properly, if the Botox administration is done and baby does not undergo rehabilitation or excessive training, the spasticity that appears again will again hamper the muscles, and the child will again go back to zero. So that's why if you are planning or trying to search for Botox administration, then it should always be combined with rehabilitation. Some doctors also suggest to do rehabilitation before the Botox administration, because if you do rehabilitation before administration of the Botox, it will give you chance to strengthen the weakened muscles first, and then after administrating the Botox, we can work on the spastic muscles. This is all about Botox. Now let's move on to surgical management. In surgical management, there are neurosurgical options and orthopedic surgical options. Neurosurgical options are not that common because neurosurgeries are complicated, and they are not much popular because the indications and the complications are a little severe in the neurosurgical procedures. And orthopedic surgeries, they can be done on the day-to-day basis, and on OPD basis also some surgeons perform orthopedic surgeries for cerebral palsy childs, for contractures, for deformities, for tendon or tendon transfers or tendon release. So let's talk about neurosurgical procedures. Selective dorsal rhizotomy, it is a neurosurgical procedure done at the lower back in the spine. In dorsal rhizotomy, what they do is, if this is a nerve which is supplying the muscle, Some fibers are motor fibers and some fibers are sensory fibers. So while doing selective dorsal rhizotomy, they will cut the sensory fibers that will inhibit the supply to the muscles of the sensory stimuli, and it will permanently get rid of the spasticity. But there are also complications of this surgery, because while performing this surgery one has to remove some of the bones of the spine, as well as after the surgery there is always a risk of lower legs paralysis, sensory loss, or bowel bladder sensation loss. So that's why this surgery is not that popular in the cerebral palsy population. What about orthopedic surgeries now? In orthopedic surgeries, surgeries to release the contractures or surgeries for tendon transfer and tendon release can be done in the patients who already have the deformity, whereas osteotomy and orthodesis can be done to prevent the deformities from happening. Again, if the child is undergoing any surgical procedure, before and after the surgical procedure, rehabilitation plays very important role in the recovery. Now let's move on the rehabilitation. So why rehabilitation? Why is it important? So rehabilitation enables the child to gain the maximal functional ability. So rehabilitation includes all the therapies. It is a multidisciplinary approach, because when we see the child with cerebral palsy, he doesn't only have abnormal tone, he doesn't only have feeding difficulties, or he doesn't only have difficulty in fine movements. He has all the features or variety of features because of the brain damage. So to tackle those features or symptoms, we need to follow multidisciplinary approach. Rehabilitation is important because it works on the principle of neuronal plasticity. So what is neuronal plasticity now? So it states that when one area of the brain is affected, unaffected brain has the ability to overcome or take over the function of the affected brain. So for example, if 20% of the brain of the child is damaged, remaining 80% brain we can train from outside, we can train, rehabilitate that 80% of the brain to overtake the function of that 20% damaged area. That's why rehabilitation is very important, and the early you start with the rehabilitation, the better are the results. However, it is never too late to start the rehabilitation. So, multidisciplinary approach or multidisciplinary team includes physiotherapist, occupational therapist, speech therapist, aquatic therapist, psychological interventions, and diet and nutrition. So, let's talk about physical therapy. So, physiotherapist will help the child to gain maximum functional independence by improving the muscle tone if it is low, by relaxing the spastic muscles, by improving the alignment, and by promoting the normal movement strategies. So, physiotherapy is important to prevent contractures, to prevent deformities, as well as to strengthen the muscles, to relax the stiff muscles. Now, once the physiotherapy forms the base for the child, occupational therapist will work on the skills of the child to do the functional activity. So, occupational therapy is all about developing skills. Even if the child has the grip strength, the occupational therapist will teach the child how to hold a pencil, how to write with the pen, how to use a sippy cup. All these skills will be taught in occupational therapy. Children who have swallowing and feeding difficulties or issues in speaking, language problems, in those children, speech therapy plays very important role for overall growth of the child as well as for the development. Aquatic therapy is water-based exercise therapy. Water sometimes plays important role compared to the land-based therapy because water gives assistance as well as resistance while exercising. So children who cannot do exercises against gravity perform very well when they are submerged in the water. Then psychological interventions for the academic skills, for the emotional and intelligent quotient of the child, psychological interventions play very important role to bring out who they are. Diet and nutrition is important for the child for overall growth and development. Now, what are the strategies when the child comes for the rehabilitation? What are the strategies that are used for the rehabilitation? So, for the spastic child, the strategy is to relax the stiff muscles, prevent deformities from happening, and encourage the movements which prevent the spastic body positions. For the floppy child, we'll provide support in a good position and strengthen the muscles. For the ataxic child, the goals will be to improve the balance, to help the child walk and stand steady, and to control the unsteady movements. Whereas in dyskinetic child, along with the goals of the spastic child, we will work on to teaching the child to hold on to something with the hands to steady the uncontrolled movements. So this is all about rehabilitation. So these are the strategies and they should be achieved by doing interdisciplinary rehabilitation approach, which we have also at NeuroGen. We have all the therapies available under one roof, which gives child interdisciplinary approach and brings out best results. Now, about the parental advice. Even if you are going to the therapies, to the professionals, you are making the child do rehabilitation 6 days a week. The role of the parent is very important in the maintaining overall health of the child. So what are the parental advices, or what are the concerns that parent usually ignored or oversee? So there are three concerns, that is hip joints of the baby, visual check in the baby, and alignment of the baby. So now let's talk about hip joints. Why hip joints are important? Because they connect our upper body to our lower body, and hip joints transfer all the weight of the upper body through hip joints to legs. So they are essential for the child to stand and walk. They are the foundation of standing. And it has been seen that 15% of the cases of cerebral palsy show progressive hip instability. This occur because of muscle imbalance, retained primitive reflexes, abnormal positioning, pelvic obliquity, and the deformity can range from mild painful subluxation to painful dislocation. And once the hip joint is subluxated or dislocated, it severely impairs child's ability to move and function. So what is the advice that parents should follow? So consider all the hip joints abnormal until proven otherwise. So even when you are not sure about the hip joint of your child, consider it abnormal unless you get it checked. So regular hip x-ray every year is important to rule out if the hip joint is normal or it has a tendency of instability. Positioning of the child is very important, which we will be discussing in the later slides. Plus, surgical intervention may be needed when the joint is subluxated or dislocated for the further treatment or further management. Now, about the vision check. So, why vision check is important and why we oversee the visual checkup? So, when cerebral palsy child presents to a therapist or when the parent is seeing the cerebral palsy child, the child has variety of symptoms such as abnormal tone, feeding difficulties, cognitive abilities are affected, fine motor skills are affected. So while treating all these impairments, we usually oversee vision of the child. We feel that because of the abnormal tone, stiff muscles, child has clumsy movements and is not able to do it, or because of the imbalance and incoordinated movements because of the brain damage, child is unable to walk properly and is looking clumsy. However, visual check is very important because due to the brain damage, it there are chances that the vision of the child is affected, and vision plays very important role in exploring the environment, in experiencing the environment. And if the vision is affected, we are limiting the child's exposure of the environment. We are limiting his abilities to expose to experience the surroundings. So there are two types of visual impairments that are seen in cerebral palsy. First is cerebrovisual impairments, and second is eye visual impairments. So in cerebrovisual impairments, these occur usually because of the damage to the brain. So eyes are normal, child is seeing normally, but the brain is not able to process the input. Whereas in eye visual impairment, child may have squint or lazy eye or farsightedness. So child is not able to see and child is having blurred vision. So these can affect child's motor function significantly. Hence, every year vision check should be done, and it should be done with the dilated pupils. So when you go to ophthalmologist, insists on checking the eyes of the child when the pupils are dilated. Okay, now let's move on to alignment and why is it important. So alignment is very important in children with cerebral palsy because it will determine the long term course of the child's health. If the child is not sitting in proper alignment, if child is not standing in the proper alignment, it is going to cause progressive muscle tightness, it is going to cause deformities, and later those deformities can turn into contractures and becomes irreversible. Hence, since young age, we should always focus on the proper alignment of the child, even when the child is sleeping, even when the child is sitting, even when the child is standing. So as we see in this picture, in first picture the girl is sitting with the curved back. There is no back support, or the hand is bent and the legs have not supported properly. Whereas in second picture we have provided, to correct her alignment, we have provided an orthotic brace to control the curvature of the spine. We have given optimal back support and hand support, so that the child can maintain the proper alignment. And with the alignment getting proper, also the child will have more freedom to do the movements, and child will be functionally independent. Now in sleeping position, now this deformity is very common in children with cerebral palsy. It is called as windswept deformity. So as you see, the one leg is rotated externally and the another leg is rotated internally. So the leg which is rotated internally is constantly pulling down the hip joint, and is can cause subluxation or dislocation of the hip in coming time. So to prevent the windswept deformity, we have to keep a towel roll or a pillow in between the legs, and make sure that the kneecaps of the child are always facing the ceiling. Now the sitting alignment. In sitting alignment, the feet should always be supported on something. The child should always sit in 90-90 sitting, because it is a functional position. And hip level should always be up than the knee level. And the maximal or optimal support should be provided to avoid spine from going into curvature or kyphosis. Now the standing alignment. In this child, the child is standing, but legs are rotated towards one side, the upper body is rotated towards other side. So this position will not give child functional independence. Child will get tired of standing like this in 5 to 10 minutes. Whereas in second position, we have corrected the feet position by giving the shoes, and we have given optimal support to the child to avoid the asymmetry. So this is all about parental advice, rehabilitation, types of CP, what causes CP. We have covered everything about CP in brief. Now I will tell you about how can stem cell therapy help in cerebral palsy. So what is stem cell therapy? So stem cells are special kind of cells which have healing properties. So according to old thinking, the scientists believe that the central nervous system, once damaged, is incapable of regeneration. So once the damage is done, it is permanent and cannot be regenerated. However, the newer studies and newer researches have shown that some regeneration is possible through a process of cellular replacement and repair. So stem cell therapy works on the following mechanisms of regeneration and repair. They cause prevention of the cell death in neuronal population. They cause establishment of the new blood vessels. Cell multiplication integration happens, and establishment of the new neuronal maps in the brain in order to learn new functions. So basically what stem cell therapy do is, once the stem cells are injected into the spinal fluid, they travel to the brain. Once they go in the brain, they have a tendency to get attracted towards the damaged area. This tendency is called as paracrine activity or paracrine signaling. So by the paracrine signaling, the cells sense which area is affected or damaged and go to that area. And once they reach the damaged area, they try to promote the generation of the new blood vessels. Once the new blood vessels are generated, the oxygen supply to the damaged area increases, the swelling or inflammation around the damaged area reduces, and by these properties of the stem cells, they bring about the benefits in the clinical symptoms as well. So in NeuroGen, we believe in teamwork. So stem cell therapy combined with neurorehabilitation gives excellent results. Why stem cell therapy is not only significant, or why only neurorehabilitation is not significant? Because they go hand in hand. Once the stem cell goes in and activates or tries to regenerate the damaged area, neurorehabilitation helps the stem cells to find the damaged area. So neurorehabilitation activates the stem cell to reach the damaged area and perform their action. And of course, success is the result of hard work and persistence. So the rehabilitation after stem cell therapy needs to be done vigorously and on regular basis, and to see the effective changes. Now we started this webinar saying that why fit in when you can stand out, right? So why fit in when you can stand out? When I say this, This is based on some people's experiences who did not let cerebral palsy define who they are. So, when I say that there are some people out there who did not let cerebral palsy define who they are, such as Dan Keplinger. He is an artist with cerebral palsy whose artwork is very famous and he draws with the assistance of the head stick. There is Key Brown, who is an author and journalist who started the hashtag disabled and cute. Archimete is well-known actor and he has performed a role in Breaking Bad. Nicholas Hamilton is a race car driver in England, and Abby Kuran is a beauty pageant contestant who won Miss USA in 2008. Justin Gallegos is the first runner with cerebral palsy to sign a Nike endorsement deal. So, when I say it, why fit in? These people have managed to stand out even with their diagnosis. They did not let cerebral palsy define who they are. But this is about the celebrities or the popular people who have diagnosis of cerebral palsy. But here at NeuroGen, we also have some little miracles uh, defi- who have not let define cerebral palsy their diagnosis. So let's see this 7-year-old boy who had involuntary movements, difficulty in performing crawling. He was not able to stand or sit. He had difficulty in performing hand functions because of the difficulty in fine motor tasks. And now look at him, how well he is doing. He started crawling. He started standing on the knees. He started standing independently after that. Then once he started independently standing, there was no stopping him. So he went on walking also. He now walks independently indoor as well as outdoor. Look at him.
Hello. Hi. How are you?
He also rides tricycle by himself now, and he goes to the regular school as well. So this is after the stem cell therapy and neuro rehabilitation. Now let's see the girl who we saw previously in the spastic cerebral type of the CP. This is the same girl, and look how far she has come from that. She also had poor sitting and standing balance, was unable to walk properly independently, had poor fine motor skills. First, she learned crawling, then she achieved kneeling. She also learned to transfer herself from floor to higher surfaces. She also achieved independent standing going forward. And from there, she started walking with the walker independently. Then from walker, she went on to walk with the cane. And then she achieved independent walking. Now she walks independently indoor as well as outdoor, goes to regular school, speaks normally, studies normally like any other child, and she is very bubbly and happy going girl. Now let's see this boy. He came to us when he was 6 years old, and after stem cell therapy and rehabilitation, he has started crawling, started walking on his knees. This is the same guy which we saw in the presentation of Ataxic CP. So he started identifying animals, letters, pictures. He started reaching out with his left hand, which he was unable to do. He started crawling in the alternate pattern, started walking on his knees independently, started sitting from floor on the stool or bench. Now he can go in his own window, sit there and watch the traffic outside. Then he started maintaining balance in standing without any external support, started walking independently. Now he can pick up the objects from floor without losing balance. He is also able to play catch and throw now. So, this was my presentation, and I tried to cover all the topics, including introduction, causes, types, as well as rehabilitation and medical management. And my take home message for all the participants is, do not let what you cannot do interfere with what you can do. And I'm very thankful for Stem Cell Africa and NeuroGen Brain and Spine Institute for giving me this opportunity to present this webinar today. And I would be happy to answer any of the questions you guys have. So there is one question, that how effective is stem cell therapy in teens? So as I said, stem cell works on the principle of paracrine activity and improving the blood vessel formation in the brain. So definitely in teenagers, there are more chances of contractures, more chances of deformities. As the child grows tall, the tightness or stiffness increases, but with the effective rehabilitation and stem cell therapy, we have seen changes in older teenage girls and boys as well, and it can definitely help. The only thing in the teenage children is the rehabilitation has to be vigorous compared to the early intervention, but it is definitely effective in the elder children as well. So, what is the situation at the moment with travel bans due to COVID? So, we are receiving patients from all over world now. We have started functioning in October 2020 again after COVID, and we are following all the COVID norms. We are doing bi-weekly testing for our staff. We are doing COVID test for the people who are coming here, and the hospital is maintaining all the precautions and strategies to prevent COVID, and the situation at movement is under control, and you can definitely think about it. How many sittings of SCT are required for a child 4 years and having spastic quadriplegic? Okay, so 4 years is definitely a good age to consider stem cell therapy, and how many sittings are required will be determined based on his scans and his clinical presentation. So once we assess the child, once we see how much brain is damaged, we can determine how many sittings he will require. But he will see improvements definitely after first stem cell therapy, and for 4 years it is a good age, tender age, so he will respond better to stem cell therapy as well as the neuro rehabilitation. So he is 13 and can't perform any activity. Can he do better after stem cell therapy? Definitely, after stem cell therapy, we have seen that arousal level of the children improve. We have seen that the attention span, concentration improve. Children try to recognize their environment, and the movement or the activities that he cannot perform can first be evaluated. We have to assess him in detail, and then we can determine the course of the treatment for him. But definitely we have seen 13 years old improving. Any other questions? Is stem cell therapy that you do forever or long term? So the effects of stem cell therapy, once you do the stem cell therapy, the effects that stem cell therapy brings will definitely stay long term or forever. So once you do the stem cell therapy and child achieves sitting or child achieves standing, then that effect is going to be there with the child forever. And stem cell therapy can be repeated. We can do stem cell therapy multiple times, and the effects of stem cell therapy definitely lasts. So yes, you can say that it is a long term treatment. Yeah, my pleasure. Thank you for attending the webinar today, and I hope. So thank you for attending the webinar today, and I hope you have got the useful information for your children. And I really hope that you found that the information that is shared today is important and useful for your children in the coming days. Okay. Thank you. I will take your leave now.